Welcome to the Osmosis Daily Report on the Coronavirus Pandemic. I'm Dr. Rishi Desai. I'm the Chief Medical Officer at Osmosis. I'm also a pediatric infectious disease doctor, and I used to work at the CDC in the Division of Viral Diseases looking at viral outbreaks. Today I want to talk about passive immunity with plasma therapy, sometimes called convalescent plasma. And to start us out, I want to look at this Lancet paper. This was put out and published a while ago, a month and a half ago, and it talks about convalescent plasma as a potential therapy for COVID-19. They actually say convalescent plasma has been used as a last resort in SARS and in other viral diseases as well. And I think it kind of set the stage for the idea of using plasma therapy. And in brief, what that means is you have patients that have recovered from COVID-19, you take antibody from those patients, and then you literally give that or inject that into patients that are suffering from COVID-19. And the antibody what it does is it binds to the virus, and by binding to the virus, that helps the person that's suffering from COVID-19 to clear out the virus and get rid of it more easily. So that's essentially how it works, and now there's some data showing that it is actually potentially effective. So let's go through that data carefully. So first off, there's this publication out of China. They say that they offered convalescent plasma therapy to 245 patients, and 91 of them showed improvement. Now it makes you wonder, of course, what happened to the other 154 patients that they're not talking about? Was there improvement there as well? But the key thing I like out of this paper is that it's a lot of patients, and they say that the plasma therapy has proved safe and effective. Now this is a paper that gets into some of the more detailed aspects of treating with convalescent plasma. This is 5 critically ill patients published in JAMA that got convalescent plasma and how they did with it. So let's start by looking at this table 1 from this paper. You can see patients are numbered 1 through 5 at the top, and if you go to the bottom of the columns, you see under treatments, the steroids and antivirals, all 5 were on methylprednisolone, and all 5 were on antivirals. This is important because any benefit we see, you might imagine it could be from these medications as well. Okay, so here's a table of what they actually received. You can see that they all got donor plasma, and you can see it's listed at 1 through 5. And the donors gave 400 milliliters of plasma to each of these patients. And what they got, down below you can see neutralizing antibody titer, that's ranging from 80 to 480. The higher the number, the more effective we would imagine that plasma to be. So really the lowest one, 80, is really quite low on the spectrum, but it did go high as 480. And to see how people did once they received the plasma, they have something called a SOFA score. And the SOFA score scores different organ systems by how poorly they're doing. So a higher SOFA score means that the patient's not doing very well. A lower SOFA score means that the patient is doing much better. So you can see the SOFA scores fell over time from 0-day post-transfusion to 12 days post-transfusion. So that's actually a pretty good sign that this was effective or seemed to be working. Now again, you got to keep in mind that they were on other medications, they were on steroids, so it's unclear exactly what was making these 5 patients better, but the fact is that they were improving. So now let's hop over to another study. This one looked at 10 patients that got convalescent plasma, and here a lot of the important information is summarized right in the abstract, so let me highlight it for you. 10 individuals, all severely ill, got 1 dose of 200 milliliters, so half the amount that we just talked about in the other study. That was 400. This is only 200. And the neutralizing antibody in this case was actually above 1 to 640, so a higher titer than what we talked about before. And again, we think that higher titer means that it's more effective. Now looking at these 10 patients in the table 2, you can see they're all on antivirals. Some of them are on corticosteroids, just like what we saw previously, methylprednisolone. So any benefit we see could be due to steroids and these antivirals again. And this is the table 4, that summarizes how they actually did. You can see that of the 10, 7 of them had RNA that was detectable. By the time the transfusion was over, 0 of them had detectable RNA. So 3 were negative to start out with, but at the end 10 of them were negative, so that's an improvement overall. And then you can see the titers actually improved as well. They checked what the antibody titers were previous to the transfusion and then checked them afterwards, and you can see in most cases they got a boost. Now there are a couple of cases, patient 5 and 6, where you didn't really see a difference because they were negative with the RNA to start out with, They already had good titers to start out with, so it's unclear exactly what happened in those two patients, but overall there seemed to be a benefit. Now, one thing they did in this study that you don't always see is they tried to find a historic control group and talked about that historic control group. So what that means is they took these 10 patients we just talked about and gave them plasma therapy, but they compared them to another 10 patients where they didn't give plasma therapy, and they talk about why they think that other group was, in other ways, quite similar. And in that other group that didn't get plasma therapy, you can see the outcomes were pretty bad. They saw 3 deaths, and they saw 6 stabilize and 1 improve. So if that's the case, then obviously it looks like this current group, by comparison, did much, much better. But of course, we don't have many details on whether those two groups were truly comparable. And again, it could have been that the improvement was due to other factors. All that said, there is now this paper that talks about how we would deploy convalescent plasma for the prevention and treatment of COVID-19. They point out that given how many people have been affected by COVID-19, finding donors for plasma probably wouldn't be too difficult. And the thing that I like about this paper is that they actually put together a workflow in terms of how you'd go about doing this. And one key thing that I thought was interesting is they suggest that we look for an optimal titer of over 320. Keep in mind, we talked about the titers that were cited in these other studies. Here they're saying the optimal titer is over 320, and again, higher is better, and maybe if that was the cutoff, they're suggesting here that that would get a better outcome overall. Now, bottom line, there's definitely potential with plasma therapy. It's been used previously in other diseases like we talked about, and I think there's going to be more and more research to come. There is a randomized controlled trial out on this right now that will help us understand what level we're looking at in terms of the donors, what volume you want to give, and then what outcomes we're really going to see in the context of people that are on other medications as well. Okay, well with that, thanks for tuning in. I hope you hit the red subscribe button and the bell icon to get daily updates. Definitely check out the osmosis.org COVID-19 page, and remember to do your part to flatten the curve and raise the line. We're all in this together. Thanks a lot.